Hello, my name is Sandro Graca, and I'm a licensed acupuncturist. I'm a lecturer at the Northern College of Acupuncture in the UK, and I'm a fellow of the ABORM, the American Board of Oriental Reproductive Medicine. Welcome to another video on this short series of advice for women who've been diagnosed with PCOS and what they can do to help with their prognosis. Basically, what we are doing with these videos is framing it in a way that will be easy for you to just take some of the advice, pick what works for you, try a few different things as well. And there's already 2 bits of advice there on that video one as well. So I'll leave the link below so that you can watch that one just to give you a little bit of context for this one. Today, we're going to go into more specifics of advice of things that you can do. We're going to give you some of the do's and don'ts as well. But to help me out, I have someone on the other side of the line. So let's go and check it out.
Hi, I'm Maya. I'm a naturopath. I have a private practice where I take patients both in clinic and online, and I also work in an integrative medicine practice.
Thank you so much for being here, Maya. It's really, really cool to do this together because I just want people to get a little bit of a sense of how you can do so much and sometimes integrating different approaches as well. So today specifically, can you please give us your top dietary advice for someone who's just been diagnosed with PCOS?
Okay, well, like you've already explained, the main issue with PCOS is hormonal imbalance, as well as the increase in risk for conditions such as hypertension, high cholesterol levels, blood glucose imbalances, which lead to type 2 diabetes and heart conditions. So while the cause for PCOS isn't 100% clear yet, what we can say is that being overweight or having an imbalanced diet, such as one that is high in sugars and saturated fats, it increases the cell's insulin resistance. And if you have high levels of insulin in the blood, that can cause an imbalance in female hormone activity and an increase of androgynous hormones, which could be part of the cause for PCOS. So if we take this into consideration, then the course of treatment has to include reducing the risk factors for PCOS development, which are, like I said, high levels of sugars and fats in the blood, as well as stress reduction, because the stress response increases adrenal hormone secretion, which will then raise the levels of sugars in the blood. And also, we want to reduce the risk factors for developing any of the conditions PCOS increases the risk of. So if we're talking about specific dietary advice, then it's to increase your intake of vegetables, whole grains, legumes, which are beans and lentils, increasing your intake of omega-3 fatty acids, and making sure that you're getting plenty of fiber. You want to be reducing the consumption of foods with high glycemic indexes, such as foods including white flour, sugars, white sugars, and such. We want to avoid, whenever possible, saturated and trans fatty acids, processed foods, and I would also recommend reducing intake of animal-based products because they contain hormones that could exacerbate hormonal imbalance that is already present.
I really like that approach, and I really like the words you used because I mentioned this on the first video, and I said what we're trying to do here is not the silver bullet that is going to cure something. It's just, as you said, it's going to help reduce the risk factors, and ultimately with time it might even reverse it, as we could see from that book that I showed on video 1.
There is no one food that is the magical cure for anything. That doesn't exist. But what I will say is that if there are a few things that you can do, you can eat fruit and vegetables because they have all the antioxidants. They just give you this huge variety of color and nutrient-dense foods in the easiest, simplest way, and they're delicious, which is a bonus. Particularly broccoli sprouts. If I had to go for one, then broccoli sprouts. Yummy. They have this peppery taste, so you can just eat them raw or in a salad or in a sandwich. They pretty much go with everything, and they're really.
So let's go with the other side of this then. Give me your top don'ts.
Top don'ts would be highly processed foods. So anything that has a list of ingredients that is probably anything more than 5 ingredients you should try to avoid. Anything that let's be honest, most people know what are the things that are terrible for them that they eat. Like I think everybody can say, like, the worst thing that I will eat is probably cookies, like mass quantities of cookies. But I realize that this is like the weakest part of my nutrition, and I am able to say to myself, okay, well, don't have all the Tim Tams in the pack.
I love those. And I remember we recorded something a while back, and we had, what was it? If there's something on the list of ingredients that you can't read, don't eat it.
Yeah, if you can't pronounce it, you probably don't want to be eating it. I think it's Jamie Oliver who has that advice. If your grandma couldn't recognize the ingredient, you shouldn't be eating it. That's pretty good advice.
Thank you so much for that. That's great advice and simple ideas for people to follow. What I'm going to do is I'm going to put a short summary on the screen now so that people can have a look. And even if they want to, just pause here and they can even just write it down. But thank you so much for that to start with. And we're going to break this video in two, and we're going to go to the next video where we're going to be talking a little bit more about lifestyle advice, if that's okay with you. So please join us for the next video for some lifestyle advice. Thank you so much for watching.